On Tuesday, officials from the Ministry of Health, their counterparts from Kenya and the World Health Organization converged in Kween district to discuss strategies of handling the recent outbreak of the deadly Marburg disease. The meeting also had political leaders from both countries. The officials signed a cross-border surveillance and response pact, not only to handle Marburg but also the outbreak of other epidemics, including Ebola. Dr. Isa Makumbi from the Surveillance Department of the Ministry of Health says the pact would help in handling the deadly epidemics from the borders of East Africa. Zonal surveillance centers will also be set up in Busia, Uganda, and Kitale in Kenya.
There is no joke about these things. That's why we are holding the bull by its horns. This is not a joke, leaders. This is not a joke. We must stop this outbreak at source. We don't want this outbreak to go to Mali, to go to Kampala. As I've told you, movement these days is in seconds. The disease travels with the people. Disease travels with the animals.
3 people died of Marburg following the recent outbreak in Kween, while other suspected cases are being monitored in an isolation center. Officials say one of the biggest challenges in managing such communicable diseases is belief in witchcraft, like is common in Sebei sub-region.
To our surprise, even people who have gone to school are saying there's no Marburg. We have got information that even the Sabine community in Kampala are saying there's no Marburg in Kween. So, and they are calling it a family challenge.
That the communities, especially in Kween, have not been very confident that this is actually a disease. They think more of witchcraft, and therefore they have been not very responsive in terms of what the health workers are telling them.
The authorities are yet to track down 2 people suspected to have contracted Marburg who crossed into Kenya to seek treatment from traditional healers and herbalists.
We have the bare minimum 2 cases that we are still trying to follow up. There's a border gentleman who moved with one of the confirmed cases. We have not yet been able to locate them. But we also have, and these ones are not really to say that we are sure that they are cases. It's just that in this type of situation, you want to rule out. So by the mere fact that he carried the patient, it's not to guarantee that he is a case, but we just want to follow him up and find out that he actually is not having Marburg disease.
For now, we are still doing the 21 days follow-up of the suspected contact, and we hope we have already done 2 tests which have turned out negative. But we are still continuing up to the close of the 21st day, which is the expected incubation period of this disease.
The Chief Administrative Officer of Kween District, Michael Mwanje, says they don't have enough funds for intervention.
The only challenge now is facilitation, which we have not actually accessed, to ensure that our health workers are facilitated to handle the work